Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Hope you guys had a great weekend, and I hope you guys are having a great rest of your Monday evening. I am back as promised. I had a wonderful weekend out of town and with my kids. We went away for the weekend, and my 15-year-old got his driver's permit, and I let him drive a part of the way home. I'm still recovering from the stress. If you guys are watching right now, thank you as always from watching. Let me know that you're watching. Let me know also where you're watching from, as I'm going to talk about an interesting topic that actually affects men and women. And we're going to talk about the whole idea about testosterone boosting supplements. Guys, I get this question a lot. In which someone's gonna, they may private message me or message me, and they might ask a question in the comments, and they'll say, well, what supplements do you recommend for this, or what supplements do I need to take? And guys, I'm going to tell you, one of the reasons why I just a lot of times don't respond is because the question needs a lot more context, and I could write a whole entire book about the answer with those different things. So, respectfully, guys, if I don't answer, it's just because it's a question that obviously needs a lot more context. So again, thank you guys for joining us. If you are watching, please let me know, guys, where you are watching from. We have people watch from all over the world, the United States. I see Canada right now, Australia, New Zealand, from Eastern Europe even, all over the place. So I always love where people are watching from. And as always, if you find what I'm going to go over with you insightful and relevant, please make sure that you share this live video, okay? So let's ask this question, and one of the reasons why I'm going to go over it as well has to do, a lot for me, working in the fitness and performance industry, and not only as well as having a specific clinic, Wellness Way clinic, because there are two kind of different maybe divisions of how I would handle something in regards to testosterone and things like that, only because there's a difference between kind of this testosterone fertility and testosterone and muscle and performance, a little bit of a difference between the two. But I'm going to answer this question about testosterone boosting supplements. Guys, you don't need to look very far to see on television, on the radio, advertisements, on the internet of testosterone medical clinics that are popping up all over the place. And basically, all they're doing is taking one or two measurements of a person's, like looking at maybe total and free testosterone only, saying, yep, you're a good candidate for testosterone replacement therapy. Let's go ahead and put you on it. And they go on it for a course of treatment. Lo and behold, a man feels better, or sometimes even a woman, and they say, hey, see how it worked. But the problem is they're not testing a lot deeper, which means you're going to run into a lot of problems, sometimes even catastrophic later on. You can actually see with hormone replacement therapy in women just how disastrous that was, over the last 40 years or so. So women, you can listen to this too, because I do run into a lot of women who have lost their sex drive. And remember, testosterone plays a role when it comes to sex drive. And yes, women need testosterone as well as men. It just so happens that testosterone is not the dominant hormone in women. But for women, yes, you are producing testosterone in the ovaries, and yes, you are producing testosterone in the adrenal glands as well. And so let's go over. With men, their main production is actually going to be in the testes. One of the biggest testosterone boosting supplements, guys, as we are watching right now, and you are letting me know where you're watching from, and you are getting ready to share this, I want you guys to know, if you're from the Chicagoland area, coming up in about a week and a half, July 23rd, we're going to be kicking off our Man Up event, as well as our Man Up Challenge afterwards. This is an in-person event. The reason why is because there is some pretty awesome experiences that we're going to be doing afterwards. It requires your in-person attendance. Guys, it's going to be absolutely awesome. It's going to be absolutely amazing. And for men, because they're not as hormonally complex as women, we're going to talk about, hey, here's some things that you can do with your lifestyle that doesn't necessarily have to cost you a penny, that has a huge, profound effect on a man's testosterone level, only because we understand hormone pathways and we also understand clinically with lifestyle what can absolutely devastate, especially man's testosterone. And so all you guys have to do to go is go to the top of the page. You're going to see it, the link to be able to register. This is for men only, and it's also an in-person event, July 23rd. Get the details if you click on that link, and please register for it. Right now we're about 2/3 of the way full. I know that a lot of people like to do it last minute. Please don't do it last minute because we have a lot to prepare for as far as the events that we're going to be doing for the weeks after this event for those people who are going to be participating in the challenge. Make sure you go to the top and get registered for that. Or maybe if you are a woman watching, please just gently nudge the significant other in your life and tell him to make sure he gets registered, or just register them and tell him you're going and you don't have a choice, okay? So getting into it, guys, what are the best testosterone boosting supplements, okay? Now, one of the reasons why I want to go over this is that it is a scientific fact that men's testosterone has been in decline over the last 40 or 50 years. I'm going to show you actually the reason why. And my opinion is that men's testosterone from a society standpoint is absolutely under attack. So if you look at, from the 1980s to the 1990s to the early 2000s, when they measured average men's free testosterone, which is what you see in the blue, you'll actually see from men basically in their 50s to the early 70s, 50 to 80, 57 to 80, 45 to 71, which is their age, and you're going to see men's average testosterone has gone from 501 to 435 down to 391. Guys, this is the same demographic of men, and what you're seeing literally in about 25 years is you are seeing an over 20% reduction in men's overall testosterone. And I would dare to say that even if you looked at it now, 10 years or 20 years later, you would actually see it even lower. So do we have a crisis in testosterone? Yes, there's multiple different reasons why. I'm going to show you one that's really interesting. But the average men's testosterone has been in significant decline over the last 40 to 50 years. So what on earth has happened? It's a lot of different reasons why. A lot of it has to do with chemicals. A lot of it has to do with insulin levels. There's multiple. Some of it can even be due to nutritional deficiencies as well. But the underlying fact is that the average man's testosterone has declined significantly over the last 40 to 50 years, which is why you actually see, these testosterone replacement clinics that have popped up. It's why you see all these advertisements, how to quote unquote boost your testosterone with natural supplements and what have you. But a lot of them aren't even talking about getting to the reason why a man's testosterone has been in decline over the last 40 to 50 years. And there's multiple reasons why, okay? So here's the typical scenario, because I'll have people reach out, whether they're, a performance athlete or whether they're, in their 40s or whether they're in their 50s, and they're saying, hey, I just noticed I don't have that edge, or maybe their wife is coming to me and asking this question. Because when you look at what testosterone does, testosterone, basically is what produces sperm, but it also is what produces muscle mass. It's what also produces very singular focus. It also is what produces aggression. And guys, aggression isn't necessarily bad, because aggression actually helps with men and their singular focus to be able to accomplish tasks. Whether what you want to do with that aggression can be used for good or for bad. That's one of the reasons why I say there is no such thing as toxic masculinity. There's just toxic people in general. You can be a toxic man. You can be a very toxic woman. There's just toxic people. And so you can use anything for good or bad. And we can't be blaming it on a hormone or something that actually makes you a man in general. Okay, I'll go ahead and say it. I don't have any problems saying that. It's what makes you a man. So when a lot of men are noticing, oh man, I just don't have the edge, I don't have the vigor, I know that my testosterone is down, rather than test it properly, or rather than, look a little bit deeper on things that they could be correcting with their lifestyle, because we have been trained that, when we need an end effect, just do this for that. We've been trained by going to the doctors. I have high cholesterol, take a cholesterol med. If I have high blood pressure, take a blood pressure med. If I have problems with blood sugar, let's go ahead and take metformin. If I have a problem with pain, take a pain medication. And we've been taught that health is just this for that, which also means if you're having problems with testosterone, just take more testosterone. Well, I don't want to take the hormone. How can I boost it naturally? So this is a very popular one called Nugenics. And actually, you see the spokesperson right here, the Hall of Famer Frank Thomas. I would not consider him the best spokesperson for this specific supplement because Frank Thomas is carrying a little bit of extra fat. That goes without saying, and fat actually is what can aromatase testosterone into estradiol. Okay, now we're getting into some lifestyle things. But when you look at this, I pulled this up because mainly around here I had seen, this as some kind of testosterone booster. And if we don't want to take exogenous testosterone, we're saying, well, how can I boost this naturally? I think I'm going to head over to, my local vitamin shop or go to GNC and ask and see, is there anything I can take in order to boost testosterone? So you're going to see some pretty interesting things when you look on this, okay? You're going to see D-aspartic acid, which is an amino acid. You're going to see fenugreek. You're going to see things like stinging nettle. You're going to see maca. You're going to see mucuna. You're going to see boron. You're going to see, Ericoma longifolia extract. Okay, so you're going to see all these different things. And actually, I'd say, well, where's the rest of it? Because there's a lot of other things that can actually help to, quote unquote, boost testosterone. But just remember this, guys, is that hormones, the reason why they're low is that hormones respond. Hormones don't cause sickness, illness, and disease. Hormones are responding to sickness, illness, and disease. That's why I always say the most powerful thing that you can always do, whether you're a man or whether you're a woman, in order to help fix or balance your hormones is to get to the reason why you're sick in the first place. Hormones don't make you sick, they make you feel sick, which is why a lot of men are walking around and they don't feel right, they don't feel sick, but what they don't feel is they don't feel the reason why their testosterone is lower in the first place. So when you look at all of these, you can look at these things and you could say, yeah, I could see why someone would be taking that, because these things can have an influence on testosterone, but it will never ever be more powerful than your lifestyle, okay? I'm going to give you an example. One of the first ingredients was 3 grams of aspartic acid. Now, I looked at this in PubMed from the National Institute of Health, and here's what they said. 3 and 6 grams supplementation of D-aspartic acid in resistance-trained men. Here's what their conclusions were. The present study demonstrated a daily dose of 6 grams of D-aspartic acid decreased levels of total testosterone and free testosterone without any concurrent change in other hormones measured. 3 grams of D-aspartic acid, which is what in this supplement that I just went over, had no significant effect on either testosterone markers. It is currently unknown what effect this reduction in testosterone will have on strength and hypertrophy gains. So there you have it. You actually have basically a study, and it involved a small amount of people, that actually said D-aspartic acid actually lowered your testosterone and really had no effect on it. Now, you may look at this and say, ha, I told you that you shouldn't ever take any of these supplements. Well, the reality is that when you are looking at supplements, is that what never ever comes into effect, especially when you're looking at a study that takes one thing and says, does it influence testosterone? Does it influence your hormones? Is that they're not taking into account all of the other lifestyle factors. So, but when you look at this, there's one study that actually says, no, it's not really doing a whole lot, especially if you are taking 3 grams of it. So, guys, when you look at a lot of the testosterone supplements that are out there right now, I kind of equate it to taking some wet noodles and just throwing it against the wall. What sticks will stick, and what doesn't, oh well. Guys, and this is one of my biggest beefs with the supplement industry. Now, full disclosure, do we recommend supplements? Absolutely. The reason why we recommend them is because their testing actually says that they need it. But how we supplement is going to look a lot different than a this for that approach. It will look a lot different. In fact, a lot of times if you said what I write out for people to be taking, some people, a special medical doctor, or maybe, a functional medicine doctor will look at that and say, well, that doesn't really make a whole lot of sense, but we're going a whole heck of a lot deeper. So here's the thing with a lot of supplements, and because I, just did a consult with a woman, I was taking several dozen supplements, but was still sick. Let me say that again, several dozen supplements, but was still sick. And guys, I always tell you, you can take supplements until the cows come home. If you're inflamed, you are inflamed. Nothing is going to heal if you still are involving inflammation and the immune system. You will never ever heal from a scab on your knee if you keep falling down on the sidewalk on it every single day. I don't care how many supplements you are taking to try to heal that scab if you are still causing an injury to it. So a lot of what you need to do is stop causing injury first and foremost. So with a lot of these supplements, it's just, let's just, throw a whole garbage load of some of these things, which we have research that can show that it can influence testosterone. And you know what? If it helps a man, great. If it doesn't, well, at least they bought 1, 2, or 3 months of it. We're still going to make a profit from it. If we get 20% of men who swear that it helps, well, that's a great way in order to make a consistent income every single month, because people will continue to take it. And this is one of the biggest beefs that I have with supplements, is that, if you stop taking them and your quote unquote testosterone goes low again, well, then you really didn't get to the cause as far as the reason why it was happening in the first place. So again, when we talk about men's testosterone over the last 50 years been in decline, yes, there's a lot of different reasons. I'm going to show actually one of them, okay? You may have seen atrazine in the news recently over the last 2 to 3 weeks from the Environmental Protection Agency that has tried to restrict the use of atrazine. I know that if sometimes people in agriculture, they get a hold of me talking about glyphosate and about genetically modified organisms, GMO foods, and about certain types of herbicides and how it affects different enzyme pathways in the liver. Boy, I tell you what, they get upset. We have been attacked many times, from farmer groups regarding this, mainly because you're saying, hey, you are speaking out against my profession. Guys, I will tell you this. If something that I do in my profession doesn't make sense, I'll speak out about it. If something in medicine doesn't make sense, it's hurting people, I'll speak out. I don't care what the profession is. I don't care what it is that we just need to be honest about it. And if you have a financial stake in this, in farming and things like that, well, you need to start saying, are we truly helping people, or are we causing long-term damage? Guys, this is actually coming from a farmer's son who was one of the first farmers in the entire Illinois that started using genetically modified crops. He started using it. And I would speak out about it, and he would vehemently defend it. He stopped defending it once he stopped being a farmer and said, you know what, I had a chance to stop being emotional about it, take a step back, and yeah, there's a reason why other countries don't want our food, is because it's laced with glyphosate and it's laced with GMO, genetically modified organisms. We have no idea how that's actually affecting our genetic expression, especially. So here actually comes from atrazine, okay? Atrazine is actually something that can aromatase testosterone into estradiol. How do you know that? Well, because physiologically speaking, it increases aromatase, the enzyme that converts testosterone into estradiol. And go back to that, looking at how men's testosterone is in decline. Not only do we have to look at, well, are we feeding things? There's an interference issue, but guys, a lot of things and chemicals that we're taking in can actually increase the aromatization of testosterone into estradiol. Okay? So that's why when they're just measuring testosterone and seeing it in decline, I'm like, okay, well, show me that person's estradiol levels as well. So atrazine is a chlorinated triazine systemic herbicide that is used to selectively control annual grasses and broadleaf weeds before they emerge. Pesticide products containing atrazine are registered for use on several agricultural crops, with the highest use on field corn, sweet corn, sorghum, and sugar cane. Okay, so this is used in crops, and right where we're at, we are in the hotbed of actually field corn. But additionally, what they say is atrazine products are registered for use on wheat, macadamia nuts, guava, as well as non-agricultural uses such as nursery or ornamental and turf. So if you go home, go in your garage, if you have a yard, chances are you probably put atrazine on your yard in order to control weeds and other grasses and any kind of broadleaf weeds in order to control it on your lawn. So not only are you getting in the lawn, but you're also getting it in certain types of agriculture. And the reality is we think, oh my gosh, maybe it's ending up in the food. But remember, that has to go somewhere, which actually ends up in our water supply. Now, this right here comes from estimated agriculture use for atrazine 2019, about 3 years ago. And when you look at this, you can see, here's where we're located on the map, and you can see that there is the highest amount of atrazine that is occurring right here. So we are in the middle of it. We're in the middle of atrazine use. We're in the middle of glyphosate use. And guys, these things influence how things are metabolized within the liver. And remember, our hormones are metabolized within the liver as well. So it makes you wonder, why on earth is testosterone going so low and it continues to be in decline? It should be a public health emergency. Why aren't we looking at those things? Well, because in my opinion, they're bought and paid for by the lobbyists. So that's why you want to get into laws, you want to get into Congress, you want to look at lobbying. This is why they turn a blind eye to those things, and they really, in my opinion, don't have your best interest in mind. So when it comes to testosterone, okay, when it comes to testosterone, and when you're asking the question, which testosterone supplements are the best for me, Dr. Nate, which ones should I be taking? Will say, okay, well, let's answer this question exactly how you're asking it. So you have to ask yourself this question. Number one, is this a production issue? Before you want to supplement or want to boost anything, ask yourself, is this a production issue? Do I have a problem getting the raw material so that I can just actually produce it? Number two, is it a signaling issue? Meaning, is it an issue between the brain and between the end product, that being the testicles? Is there a problem with the hormone response from the brain, from the pituitary gland, down to the testicles? So that is a signaling issue. Number three, is it a conversion issue? Meaning, if I can produce it, I can signal it, but is it getting converted into a different form, like DHT, or into estradiol? And so that would then not be a production or signaling issue. It's going to be a conversion issue. That's why you got to take all of these three things into account. And it's also why when you look at testosterone boosting supplements, they're really just taking, well, this, and this, let's throw it all together and let's hope that actually something works, okay? So let's talk about a production issue. Because when you're talking about a production issue, this is also going to be the same when you are talking about the thyroid gland, okay? This is why, sometimes people say, oh, well, I have a thyroid issue. Maybe I should just take more iodine. Guys, I will tell you very rarely, and when we test a person's thyroid gland and thyroid output properly, very rarely is it actually an iodine issue. And in fact, I have probably recommended iodine in 3 to 4 years, 5 or 6 times, and that literally is it. So when you're talking about production, you're talking about and asking yourself this question, hey, do I have the raw materials to be able to produce testosterone? So some of the best things that you can do when it's coming to a production issue is going to be liver and it's going to be zinc, okay? Now, you can take a desiccated liver. You can also eat liver. Liver is nature's multivitamin. So there actually will be zinc within the liver, but also you can take extra forms of zinc, which is why I always will say, don't ever take a zinc isolate, which is why, I've talked about this, people coming in taking 100 milligrams of zinc, and the reason why is because some doctor on the internet said that they should and offered a very blanketed protocol in order to avoid a specific illness. You know what I'm talking about. So zinc should come from food. It should never be in a zinc isolate, and the best forms of zinc is actually going to be from oysters. This is actually one of the reasons why oysters are considered an aphrodisiac, because of the levels of zinc that are in them. So zinc, if you're taking it from oysters, will also have a little bit of copper as well as liver, which you need both of them. So if it's a production issue, then you actually just need to feed the production of it. You need to give it the raw materials. One thing that I failed to put on here as well, one thing that can help as far as a production issue is not only taking a liver glandular, but also taking a glandular coming from bull testicles, all right? Rocky Mountain oysters, which we used to eat these things 100, 150, 200 years ago. We used to eat the cow from horse to tail, or from tongue to tail. And so nose to tail is actually what they call it. So, if it's a production issue, then you need to actually get the things that are producing it. It's the same thing, guys, when it comes to your thyroid. Your thyroid, you need, amino acids like tyrosine. You also need things like selenium. You need things like iodine. You need the raw materials. But guys, usually it's more than just one issue, that being the only thing. And I would actually venture to say if you aren't getting enough liver, you aren't getting enough zinc, then you probably have some other problems too with your blood sugar and things like that. Now the next thing is can it be a signaling issue? Same thing with the thyroid. Thyroid can have an issue with signaling. Might be a problem in the GI system, might be a problem in the gastrointestinal system, there might be a problem with too much fluoride, toxicity, chlorine, bromine, in which you don't have a problem with production, but you have a problem with conversion, or you have a problem with signaling from that specific hormone going from T4 and T3 and actually being utilized by the cell. Same thing happens when it comes to testosterone, is it can be a signaling issue. So one of the things as far as signaling is concerned is, hey, you have a stimulating hormone in your pituitary gland, and it needs to travel down through the bloodstream, and it needs to stimulate the specific cells of the testosterone to produce testosterone for sperm production, okay? Now, that can also get blocked as well. So what are some things that can help specifically with signaling issue? It doesn't directly affect testosterone production, but it will stimulate the stimulating hormones that will help indirectly with testosterone production. So this is why there's some wonderful things as far as tribulus, okay? It's called tribulus. About maca as well. Maca is I think it comes from Peru, and is very similar to like a potato. It's a root vegetable, but it is very, very high in specific antioxidants, and it's very, very high in things that can help assist signaling when it comes to your hormones. That's why we recommend it for a lot of men. We also will recommend it for a lot of women, especially during certain parts of their care. In addition to that, you also have mucuna seed. And mucuna is used for a variety of different reasons, but it's also high in zinc, and it also can help with testosterone signaling. What's interesting is we use it a lot with people who are having issues specifically with the neurological portion of their adrenal glands, especially when it comes to adrenaline production. What's so interesting about mucuna is if people are having issues, especially with tremors, whether they're intentional tremors as they intend and they start to shake, that's often seen as Parkinson's disease. When you can give high doses of it, you will actually start to see the tremors start to go away. So mucuna also can assist in signaling issues, as well as ashwagandha as well. Ashwagandha does a wonderful job as far as lowering cortisol levels or helping a circadian rhythm. And just remember, stress doesn't affect testosterone as much as stress affects a woman's hormones. But just remember, if a man is under a tremendous amount of mental stress, yes, long term that will affect a man's testosterone level. And so really ashwagandha has more to do with the mental more than anything else. And it actually will work at the pituitary gland, which is why a lot of these different types of herbs, they're really working within the brain, not as much as they're working on the actual target tissue. Now the third thing is it a conversion issue? Meaning I can produce it, I can signal it, but you know what? What I'm producing is getting converted into other forms of it. So you have things like passionflower, gymnema, golden seal, saw palmetto, Japanese knotweed, fenugreek, nettle leaf. And guys, when you look at all of these will play a different role in specific types of conversion. For example, passionflower does a wonderful job of actually preventing testosterone from aromatasing into estradiol. There's crossover effects with passionflower. It helps a lot with muscle soreness, as well. It's also very calming. Gymnema, how can gymnema actually help? Well, again, high insulin caused by high blood sugar can also cause testosterone to aromatase into estradiol. How does Gymnema work? Gymnema actually blocks the crossing of sugars over through the intestines to be taken into the liver. So by blocking or slowing down or throttling the absorption of sugars, you're going to lower your blood sugar, you're going to lower your insulin response, therefore helping to maintain testosterone longer. Same thing with Golden Seal. Golden Seal will do the same thing as Gymnema. Saw palmetto has to do with preventing conversion of testosterone into other forms of like DHT, dihydrotestosterone. This is actually why DHT. They give them DHT blockers, especially when they are having prostate swelling or having elevations in some of their prostate lab markers. And so saw palmetto actually will block that. Okay. Also, men with high DHT not only can have issues with prostate swelling, but they'll also lose their hair faster as well, which is why saw palmetto is actually considered a DHT blocker, and indirectly can start to slow prostate growth, benign prostatic hypertrophy, but it also technically could help you maintain the crown of your head on your hair, or your hair on your head for longer, because DHT is actually what kills the hair follicle. Japanese knotweed actually helps with a lot of estradiol metabolism, pushing it over into the protective pathway. Fenugreek, works as well. Nettle leaf into free, taking bound testosterone and helping to make it more bioavailable by going from bound into free testosterone, which is actually what your body uses. So you guys, you see all these different things. I'm like, yeah, all of these could actually influence your testosterone. There's no doubt about it, okay? Now, should I come up with some kind of supplement that contains 25 different things? The reality is that if you were going to take enough of those things and just throw a wet noodle against the wall and hopefully that it sticks, you would have a testosterone boosting supplement that would be about, about this big. So how on earth do they have you take 2, 3, or 4 capsules that are tiny, thinking that it's going to make any kind of difference? And the reason why is because they're not testing, and how you know what will work best is to actually get into the nitty-gritty of it and actually test, and stop wasting your money on novel types of things like testosterone boosting supplements that you are getting from a health food store or from GNC, whatever it might be. So that the answer is, guys, is that anything that is going to decrease inflammation, lower stress, improve sleep, lower your insulin, and feed your hormone pathways, anything that does that will really improve testosterone. Which is why when people say, what is your protocol? People say, how do I balance my hormones? Guys, there is no protocol. I told a woman today, I was like, looking at you, being on so many different supplements, being on so many different medications, beyond the fact that you've been on steroid meds for so long, that you've been on exogenous hormones for so long, I said, just the fact that you've been on steroid meds for such a long period of time, this is why your thyroid's messed up. This is also why you have no energy. Because if you are feeding the body cortisol to convert into cortisone, your body thinks it's going to be in a stress state. You've been doing it for a very long time, which means your adrenals are basically tanked now. And this is why you also have issues with your thyroid. How long does it take? What the research says is 6 months to a year for the adrenal glands to start to recover. And that's only if you're able to go off of any kind of steroid medication. So guys, anything that decreases inflammation, lowers stress, improves sleep, lowers insulin, feeds hormone pathways could technically improve your testosterone, which leads me to this, which is why, guys, that you test and you don't guess. Stop guessing and start testing, and start testing properly. So what do you need to be testing for? I'm going to talk about men in particular, because these are some of the biggest issues. And we'll actually test this a lot deeper than just this. I'm going to tell you, go to your doctor and you can't get a lab, from me, is here's what you need to test. Number one, test A1C, 90-day blood sugar. Okay, not your blood sugar, but your 90-day average blood sugar is called A1C. That should be anywhere from 4.9, I'd say, to 5.2. Number two, you should be testing your insulin levels. Guys, it is so hard to talk about insulin with the patient, because all they're talking about is their A1C and their blood sugars, and they have no idea what influences their blood sugars, which is actually their insulin levels. So guys, if you have very high insulin levels, it means you're insulin resistant. And it also means that if you have high insulin levels and you are actually blown over on your A1C, you're getting into 5.7, 5.8, 6.0, 6.2, 6.7, it means that no longer your pancreas can keep up anymore. Insulin is produced by the pancreas. We want those levels to be at about 3 to 5. I actually tested mine the other day, and my levels were at 6. So for me to have an A1C, it's at 5.2. And my insulin levels are at 6. That's all they are. I have seen people in 15, 20, 25, 50. I have had some people be at over 900. They were at that point actually taking exogenous insulin just to keep their blood sugars at about 150 to 160, if you can imagine that. When I see that, I say, who in their right mind would hire that doctor when they are keeping that person chronically ill by not getting to the cause? So you got to be testing, guys, your insulin. Now, even for me having levels at 6, 6.5, right around there, I said, you know what? Let's see if we can get it even lower, which is why right now I am on my third 3-day fast in as many weeks. Guys, please don't do this. I am actually just doing it mostly for mentally. But by the time I get done with this fast, I will have not eaten. would have eaten 7 days out of the last 16. It's not that I'm recommending it. In fact, I wouldn't even recommend it for people, especially if they're like taking medication for type 2 diabetes and things like that. I have my blood work, so I know I'm going to be good, with doing that. And I know a lot of you are going to ask, what's your protocol for a 3-day fast? Please don't ask, all right? So you need to be measuring C-reactive protein as well. Inflammatory marker. Should be measuring your homocysteine levels. You should see those levels at about 9 to 10, maybe 11, but you don't want to see those things elevate. It's a huge cardiovascular indicator of stroke and heart disease. You should also be measuring, guys, free and total testosterone. So free and total. So you want to see how much is bioavailable, and then you also want to see what your total production is, because there's a difference between those two, because you can't have a lot of total testosterone. It can actually be bound up, which is also why you should be measuring things like sex hormone binding globulin. You should be measuring your estradiol levels. You should be measuring DHT. You should be measuring all of those different things to get an idea. And I would say if you saw some of those things, you would be able to say, all right, well, you need to be working on this. This would benefit you the most, but it also would always be coupled with changes in your lifestyle. Let me say that again. It would always be coupled with changes in your lifestyle. And then the last one, if you really want to see how your body is metabolizing, especially for anyone on hormone replacement therapy, that includes men as well, is get a Dutch test, because this will actually show if you are taking any kind of exogenous testosterone. This will show exactly how it is getting metabolized, and it can go down some very bad estrogen pathways when you are supplementing with exogenous testosterone. And guys, doctors are not measuring it, and they may be leading you down a very bad pathway. Remember, last week I talked about breast cancer. A week before, I talked about breast cancer in men and how it's actually increasing quite a bit, so much so that they're now talking about it. And so the only question is guys, if you have a doctor that is saying, go ahead and just take this. We measured one thing. Yep, you're low in estradiol. Go ahead and take that. Lower your progesterone. Go ahead and just take some. Or you're low in testosterone. Just go ahead and take some. We'll give you that. We'll roll it underneath your arms or across your chest. Guys, you should run away from that, because they're not testing you properly. And again, like I said, they can lead you down some very bad pathways. And we have tested so many women. When they look at this, the first thing that they say is why didn't anyone tell me this? And I said the reason why they didn't tell you is because they didn't know. Because remember, in so many different things, we're taught just do this for that, and there's going to be no consequence for doing that. So you have to look at how the body's actually metabolizing those things. So guys, if you enjoyed this, please share this video. Especially share it with your man, share it with your significant other, and get them to understand is how you can, quote unquote, boost your testosterone. And it isn't as much as figuring out what you need to get from GNC as much as you need to test for things properly. You need to change your lifestyle with many men very dramatically. And if they can start doing that, they'll put them on a path to having elevated normal testosterone levels. The reason why is if you have the machinery, if you got the machinery, then there's no way that you shouldn't be able to make adequate testosterone levels, yes, into your 60s, yes, in your 70s, yes, in your 80s. The reason why is because we have elevated men's testosterone actually with no supplementation whatsoever and gotten it from in the 300s into the 700s. And these were people in their 50s, 60s, and 70s only because we understand hormones and how they respond to inflammatory triggers. And if you are watching from the Chicagoland area, guys, please do me a favor and get registered for the Man Up challenge that's coming up, or Man Up event, July 23rd. I believe it starts at 10:30. The Eventbrite information will be on that link. Please make sure that you register for it. We're going to go over some of the biggest roadblocks to testosterone. We're going to go over 4 main things on what you can do in order to start to massively play a role with a man's testosterone in a very, very short amount of time. But then we will also go over some of the things that we are going to be doing week by week in order to make sure that the lifestyle starts to match up with your intentions. Get registered for that right now, July 23rd, Eventbrite link right at the top of the page. Now, next week, I'm going to be talking about how to raise testosterone without spending a penny, okay? Guys, there's too many times we think, oh, well, I can't afford it. You can afford this because it's not going to cost you a single penny. Yes, you might need to spend a little bit more when it comes to food, but I will tell you something. I'm fasting for 3 days, which is a great, great thing in order to increase a man's testosterone. And guess what? I will save a lot of money when it comes to food. So guys, if you want to do something, you're going to find a way. And if you don't, then you're going to find an excuse. And the reality is, there's a lot of men with such low testosterone. Boy, I tell you what, they find any excuse not to improve their lives. And at this event, we are looking for a group of men who are saying, you know what, it's time. I'm going to man up and I'm going to start making a difference in my life because I want to leave a legacy. I don't want to leave this earth being the uninspired man that I see so many times in our society. I want to be a man who's inspired. I want to be a man who's on fire. I want to be a man who makes a difference in other people's lives. That's the way genetically that we were created. So guys, next week, join us at the same time. We'll talk about how to raise testosterone without spending a doggone penny. And then hopefully, guys, I see many of you on July 23rd at the Man Up event. I can't wait to do it. I really can't. And guys, I'll tell you something. I do this once or twice a year, and really I do it with the intent in order to change a man's life. This is just really doing this is just a hobby. It really is. But again, for me, I want to leave a legacy, and I want to make a difference. And there's nothing that makes me happier to see a man 5 years later say, you know what? I remember I did that. I remember the difference you made in my life. Thank you for doing that. This is the reason why I do it. And it's the reason why I go live every single week. So I hope I made a difference in your life. And if I did, please share this video and let me know again where you're watching from. I hope you guys have an amazing, awesome evening. Be well, be blessed, and we'll see you guys very soon.